Understanding period pain. What's normal and what's not? What if the pain you feel every month isn't just part of being a woman? For many people, period pain is dismissed as normal. But how do you know when it's actually a sign of something more serious? In today's video, we're breaking down the difference between normal menstrual cramps and symptoms you should never ignore. Period pain, medically known as dysmenorrhea, is incredibly common. But while some discomfort is expected, severe or unusual pain could be your body asking for help. Let's talk about what's normal and what's not. Section 1. What is normal period pain? Typical period pain usually begins just before or at the start of menstruation. It often lasts 1 to 3 days. You might experience mild to moderate cramping in the lower abdomen, a dull, consistent ache, pain that radiates to the lower back or thighs, fatigue, occasional headaches. For most people, these symptoms are manageable. Over-the-counter pain relievers like NSAIDs, rest, and using a heating pad can make a big difference. While uncomfortable, this type of pain usually doesn't interfere significantly with daily life. Section 2. When is period pain not normal? Now here's where it's important to pay attention. Period pain may be considered abnormal if you experience severe, debilitating cramps that disrupt work, school, or daily activities, pain lasting longer than 3 days, irregular menstrual cycles, unusually heavy bleeding, lower back or sacral pain that radiates down the legs. If your symptoms feel extreme or progressively worse over time, that's not something to ignore. Pain that controls your life is not something you should simply push through. Section 3. Possible causes of severe period pain. Severe menstrual pain can sometimes signal underlying conditions such as endometriosis, when tissue similar to the uterine lining grows outside the uterus, causing significant inflammation and pain. Adenomyosis, when the uterine lining grows into the muscular wall of the uterus, often leading to heavy, painful periods. Fibroids, non-cancerous growths in the uterus that can cause pressure, heavy bleeding, and discomfort. Pelvic inflammatory disease, or PID, an infection of the reproductive organs that can result in severe pelvic pain. These conditions require proper medical evaluation and treatment. Section 4. When to seek medical help. If your period pain affects your quality of life, it's time to speak with a healthcare professional. A proper evaluation can help identify the cause and guide treatment options, which may include prescription medication, hormonal therapy, or in some cases, surgical intervention. You deserve answers, and you deserve relief. Period pain is common, but suffering in silence shouldn't be. Understanding the difference between normal discomfort and abnormal symptoms empowers you to advocate for your health. If something feels off, trust your body and seek professional advice, because your pain is real and it matters.